there should be 4 different things in your packet. If you don't have something, please let me know, okay? So let's talk about preceptorship. Our first thing in our packet is just a general overall letter to your preceptor. So when you go and meet with your preceptor, you're gonna hand them this letter. It's basically telling them, thank you so much, we're delighted, excited that you are going to precept one of our students. We're very grateful for this opportunity for them to learn from you, something along those lines. Just real basic, kind of introducing ourselves. It also has my contact information down there at the bottom. Okay, that is my office number right there, down there at the bottom. So you're gonna hand that to them as well. And then this is there for them to keep. All right, if they throw it away or do whatever else with it, that's fine too. But I don't need this back. Okay? Other paperwork that we're gonna need for our preceptorship. So everybody have a Nursing 221 preceptorship manual. Okay. You are responsible for all the information in this preceptorship manual. Before you start, please read through all of this in its entirety, okay? When you go meet with your preceptor for the first time, bring this with you, review the content with them as well, so both of y'all are on the same page, all right? This is gonna be the thing for preceptorship. This must be with you at all times when you go to your clinical site for your preceptorship. No matter what, don't forget this, all right? Leave it in your backpack, leave it in a folder, so every time you go to preceptorship, keep this with you, okay? So let's look through it. Page 2, just your contents. We have our contact information on page 3. So that's me first, that's my work number, and then my cell phone number as well. And then we have Dr. Schreiber and Dean Davis if they need to get in contact higher up from there. So you can highlight that information, give them that information, that kind of stuff. Before I forget, everybody pull out their cell phone real quick. All right, put my phone number into your contact information. Three 334-750-4167.
Can you say that one more time?
334-750-4167. That's my direct cell phone number. All right. If you ever forget, it's also in your preceptorship manual as well. Go ahead and add it into your contacts so you don't forget it. If your preceptor needs to get in contact with me, they can also use that phone number too. Okay. We'll talk about why you need it here in just a moment. Page 4 and page 5 of your preceptorship manual is all about your learning outcomes, our course objectives. So that's basically just our accreditation board, our CUSIN goals, your human flourishing, that kind of stuff, why we're doing this. Then page 5 is going to be more of your goals of preceptorship. Remember, no matter what unit you get onto, if you don't like it, that's okay. There's always something to learn, something to pull away from preceptorship. Your nurse has so much information that they want to pour into you, okay? Try to make you the best nurse possible, so in a few months when you start applying for jobs and start working as a real nurse, you're ready to go. So just because you don't like the unit that you're on, make the best out of it. Make the best experience possible that you can, all right? We want you to be that well-rounded, safe, awesome nurse that you're gonna be. So please make the best of it. That's kind of our goals of preceptorship. Fine-tune those skills. Find different opportunities to learn something, okay? If Zach's on another baby, he's gonna get real excited for babies for about 3 months, okay? Okay. Page 6 is gonna be kind of a good page for you to highlight with the person you're gonna be with, your preceptor. It's their responsibilities. And then your student responsibilities, what you're gonna be responsible for, is down there toward the bottom, right there. And then page 7 finishes off your responsibilities, and then my responsibilities as an instructor for you. Basically, I'm here and available for you no matter the circumstance. You can reach out to me at any time, and I'm available for y'all, okay? Just because you're in a different unit, you're at a different facility with a different preceptor doesn't mean I'm still just off doing whatever. I'm here for y'all, okay? Of course, your clinical guidelines, your procedures, your responsibilities are gonna be very similar to what you're expected to do at clinical every single day. So you should be ready to go and prepared every day of preceptorship. Things I want to highlight, page 8. So flip over one more here. Students must have direct supervision during the following. So administering IV push medications, that's a big one. Mixing of any medication, so anything that you mix, antibiotics, insulin, those types of things, you're gonna need supervision for. Some of y'all that work in some type of mother-baby unit, or a NICU, or L&D, one of those units, remember that you cannot start an IV anybody younger than 16, all right? I don't want you sticking no poor little baby's scalp for an IV. We're not ready for that just yet. When you get out into the real world and you get to whatever exciting unit that you want to be on, you'll get that on-the-job training from there, and you'll learn how to do those specific skills, okay? Remember, no one under the age of 16 can you start an IV on. Otherwise, skill-wise, anything that you've been checked off on in school, you're allowed to do, okay? So your NG tubes, Foleys, starting an IV, central line dressing changes, vital signs, PO meds, IV push medications, all the things you've done in the lab, all the things you've had a check off on, all the things you've done in clinical, you're allowed to do at this point. So practice within your scope. Don't go off cowboy nursing and doing what you have not been checked off on or have done in some type of clinical situation, all right? Big things kind of where you run into situations like that is, again, if Zach is on mother baby, he's not gonna be performing no vaginal exam. Have I taught y'all how to do a vaginal exam? You have not, so we're not doing vaginal exams, okay? You can watch, you can observe, and absorb as much as you can by visualizing the vaginal exam or checking the cervix, something along those lines. But you're not allowed to perform that task, okay? That makes sense? Perfect, okay. See, bullet point G there, students must be supervised for all medications administered. This is kind of a gray area. If your preceptor has watched you give 100 PO meds and they fully trust you in giving your PO meds, you're okay, okay? Use your discretion on that. If they trust you, you are working under their license, so if they trust you to give that PO med, you can go in there and do that. Continue your rights of medication administration, your safety procedures, the things that you do every single day in clinical. Now, anything invasive, so anything that you're putting into somebody, so like an IV push medication or a Foley insertion, NG tube insertion, a registered nurse has to be with you at all times to supervise you and keep yourself safe, all right? Try to keep you safe and keep that nurse safe at the same time. So really think about it how you would think about it in clinical. Do I need Mr. McCarty with me to do this procedure or skill? If it's a yes, then you need a nurse in there as well. If it's, well, he allows me to give PO meds by myself, I'll check with a nurse to be sure she's okay, and then I can do it by myself, all right? So think about that while you're doing your skills and your procedures. Must be supervised during tube feeding boluses, starting continuous infusions. Every triage, you get a new patient on the unit, a patient's crumping, or you're in the yard running triage, nurse needs to be with you at all times for that as well. verbal or phone orders, you might have the chance or the opportunity to take orders over the phone, put it on speaker, allow the nurse to be sitting right there with you, taking that verbal order with you, all right? You're not allowed to do that independently, okay? Then transporting a patient as well. If you're to sign for anything, make sure that preceptor is right there with you and co-signs with you right beside your name. If it requires RN at the end of your signature, nurse has to be with you and has to sign with you, all right? You are not quite RNs yet, but you're close. So keep that in mind. So only one time per patient on your IVs. So don't sit there and stick 100 times. You only get one chance, and then your preceptor or somebody else has to start that IV, all right? One time per patient, okay? We already talked about number 10, but remember to have somebody with you to co-sign your orders, to talk to you about your orders, put your physician on speakerphone, something like that, so they can hear that as well. Incident reports, you also need your preceptor and work with the the facility to carry out their incident reports and how they would run their protocol. If you have to do a safe or documentation that something didn't go right or an exposure, you have to run that facility's protocol, okay? Things you're not allowed to do. So vaginal exams on OB patients or obtain vaginal cultures. If you haven't been taught it, don't do it. If you haven't been checked off on it, don't do it. Any IV on children under the age of 16. Of course, you can't do any blood or blood products. Even if you're picking them up, make sure the nurse is with you so they can sign off on blood products. You can watch, you can visualize how to administer blood products. That'll be good practice. And so you're kind of familiar with it when you get on your own, but you're not allowed to do it. Chemotherapy drugs, witnessing consents, obtaining cord blood, and then controlled substances, blood products, or like double checking or witnessing. So if you're wasting morphine, some facilities require that you witness how much insulin you drew up, those types of things. You're not allowed to witness for another nurse, all right? Your preceptor has to do it for you, okay? That makes sense for everybody? Okay. At the same time, I don't want you to hold back. Just because you can't do these things doesn't mean you don't just sit around, all right? Go out, get some experience, have that gumption, that desire to improve yourself. Remember, as you're going into preceptorship, this is like a job interview, all right? If you precept at a place you potentially might want to work, they're watching you 24/7, trust me, okay? Every time you show up early, every time you show up late, they're keeping track of that. How well you take care of patients, how knowledgeable you are, how you're good at your skills. They're taking all this into account. If you're a well-rounded nurse, they like you, more than likely they may hire you at some point, okay? They're always looking for new grads. They love Southern Union nurses, all right? When you tell them you're from Southern Union, they're gonna watch you because they wanna know if you're a really good nurse. 9 times out of 10, we're really good nurses, all right? So this could be a potential job interview for you right off the bat. Page 9, has a few other things for you, what you should do, if you're absent, if you're injured, that kind of stuff. We'll talk about it in just a moment. All right, move on to page 10. Here is your skill checklist or check off that you have done in your preceptorship during your time. So read through these very carefully. And this is why it's important to keep your manual on you at all times. That way you can come back through and check these when you do these types of procedures and skills. So run through these, make sure you're familiar with these, and we'll try to get you in to almost all of these by the end of your preceptorship. So teaching to a client or family, documentation with evaluation of teaching. Usually that's pretty easy, standard. At some point you'll have a discharge. new procedure, new skill, new medication, something along those lines that you're gonna teach your patient, teach your family, and you can really get that out of the way, okay? So you got professional identity as well, read your policies and procedures, on time to all clinical shifts, and maintain confidentiality of all clients at all times. Of course, on the right side over there, it says never times performed. That's just a standard. You're supposed to do that every single time you walk into that hospital and work for your preceptorship spots. All right, so that's all the time. Some that are gonna be kind of difficult, so if you look down there at nursing judgment, your end of shift narcotic count, sometimes that's a little hard to be a part of, depending on facility, depending on unit. They may not do a narcotic count as often. ICU does them more frequently because we pass out a lot more narcotics. So depending on what floor, what unit you work on, you may not see that as much, and that's okay, all right? We really want you to get all these in, but if you can't, some of these are okay, all right? Medication dosage, you're gonna do that often. Your IM and sub-Q injections. So they're still doing flu shots, pneumonia shots, that kind of stuff, so you should be able to get some opportunities for IM injections. Most everybody's gonna do some insulin, Lovenox, heparin, something at some point, so you're gonna do some sub-Q injections. IV push medications, you have IV fluids or piggyback to an existing line. Another difficult one that's going to be hard for some people is successful IV insertion. And that's key word there, successful IV insertion. That's not if you missed or you attempted. You actually got it and did it appropriately. Now, going back to Zach's example, he works in mother baby with the babies. Can he start an IV on a 16-year-old or less? He cannot, okay? So if he deals with babies all day, we could run into a problem with that. We really want you to get these skills in. So what we can do is talk to your nurse that you're precepting with, or maybe the charge nurse, and they can call a sister unit and say, hey, I have a student from Southern Union, they need some skills validations, can they come over and start some IVs? So if you're in OB, you're in NICU, you're in one of those kind of units, more than likely they'll call mother baby or OB obs, or they're doing C-section day. You'll get a lot of IV starts in there. You'll get a lot of Foleys in there as well. So you'll get a lot of experience. Sometimes they may call down to the ER and allow you to start IVs and triage. That way you can get some of that experience in, okay? But we'll find some opportunities for you. If you're still having a difficult time finding these opportunities, let me know, and we'll come up with a game plan so you can get some exposure to these types of procedures, okay? So go to page 11 here, the next page. There's also one that says something about sterile technique. Yeah, so right after that successful IV insertion, sorry, I thought it was on page 11. The very last one on page 10 here, sterile technique. That could be your Foley insertions, your NG tubes, some of your wound cares, not NG tubes, some of your wound cares, your central line dressing changes, that kind of stuff. So if you're in one of those units that you're having a tough time finding something, you might be able to get into a sister unit where you can put in a Foley or do a central line dressing change and get at least one of those sterile technique skills in, okay? So now page 11. On page 11, you have the last section there, spirit of the inquiry, quality improvement, evidence-based practice. So that's learning about or participating in a hospitality quality improvement project. This can be difficult at times because a lot of times the nurses try to avoid quality improvement projects as well. So you can go to the charge nurse as well and see what kind of opportunities there are for quality improvement. What are we tracking? What's the data on urinary tract infections? Are we implementing some new procedure where we're doing 2 nurse Foley insertion to reduce narcotics? Find a study, find something that they're trying to do a quality improvement on, and be a part of that, learn about that, educate yourself on what type of projects are being going on around that facility, okay? And get that chance for that. The last box there, other skills performed. This is your time to brag about yourself. How busy you were, how many different things you did. There's no NG tube skill performed on the bullet points here. You can put your NG tube skills on there. Wound care management, you can put that in there. Okay? That other skills performed is kind of a very broad box. Brag about yourself, what type of skills you've done. With all these skills, you got to have your preceptor initial behind it to say, yeah, they did that, okay? Don't just start making stuff up, get them to sign them. Make sure they're in the room, make sure they're observing you do this so they can check off behind you. Now, if you're, let's see, sub-Q injections. So if you're like on a med-surg floor and you give Lovenox about 100 times a day, after the 40 or 50th time, I don't need to know that you've done it 100 times, okay? Get you a good round number and then call it quits. That's fine, all right? So if you start checkboxing along the way and you start tally marking and you run out of tally marks, you're probably okay, okay? I don't need to know that you've done 100 sub-Q injections, all right? Focus on some of these other areas once you start running out of space on some of these, okay? Find ways, opportunities to get some of these skills out.
So every time we get a skill, you want us to like mark it?
Yeah, you know, you do 4 and then the 5th one's a slash, you keep going, you can do it that way. If you want to do math, you can do it that way. I would recommend just the tally marks on that, okay? All right, let's move on, page 12. Page 12 is going to be at the very end of your preceptorship. All right? This is your preceptor and you sitting down and talking about your overall experience of your preceptorship. And then they're going to say, yes, you've completed the required 120 hours of preceptorship. So that's what that first section is. You'll fill this out at the very end. Then it says preceptor comments. This is their time to brag about you, any things that you could work on, anything that they have to say about you in this box right here, okay? So this is at the very end, page 12 is at the very end of your preceptorship, okay? Page 13, also at the very end of your preceptorship, you're gonna fill this out. This is your time to reflect on what you did during your preceptorship, what kind of insights you have, any valuable knowledge that you gained overall, how do you feel like you did? And it's gonna be in that student comments box right there, okay? You can also highlight your preceptor, give them a shout out, that kind of stuff as well, so we know about future placements for preceptors and stuff, okay? Next section, it says your student signature, your preceptor signature, and your faculty signature. All right? So your final preceptorship day, you're gonna run through your skills, make sure everything's checked off, everything's initialed appropriately for all the skills you've done. You're gonna attest that you've completed your 120 hours. So you're gonna sign in the student signature box. They're gonna sign in the preceptor signature box saying that you've completed your 120 hours. And then when you return it to me, I'm gonna sign in that faculty signature box. So we need 3 signatures total to complete this packet, all right? There's one final one down here at the bottom. I was visited during my preceptorship on by this faculty member. So at some point, at any time, it doesn't matter when, what time of day, what time of night, you could have a surprise visit by any full-time nursing faculty. It could be me, it could be Dr. McCarty, it could be Dr. Stokes, Dr. Shriver pops in every now and then. You never know when we might just pop up. Really, to hold yourself accountable, make sure you're there for one. You're not lying to us, okay? But also to talk to you, see how things are going, making sure you're getting the best out of your preceptorship. If you have any concerns or comments, we'll talk about it then. Then we'll also talk to your preceptor and see if they have any concerns. If you're not doing what you're supposed to, maybe you're not strong in a certain area, maybe we need to go back and refresh and review one-on-one time with you as well. After they have that visit with you, your faculty member that visits you is gonna sign that box right there. We try to get to everybody. There's only 13 of y'all, so more than likely we're gonna get to every single one of y'all, all right? Day cohort has about 60. It's hard to visit 60 people in a semester, okay? Night shift people, if you have night shift, you're not left out of it either, okay? We could pop out 1, 2 o'clock in the morning, you just never know, all right? Okay? Questions about that? That's your completed preceptorship manual packet, all right? That's why it's very important to keep this on you at all times. So when we visit you for one, we can sign the appropriate boxes like we need to. You can also keep yourself accountable for your skills. You can reflect back on it if you have a question about something. Can I do this? Can I not do that? It's all in this packet right here, okay? So keep this with you at all times, okay? All right. Questions about preceptorship manual? Nope, okay. All right, the next one should be your student preceptorship contract. So when I go to meet with my preceptor for the first time, I'm taking my student letter, taking my preceptorship manual, and I'm also taking my preceptorship contract, all right? Preceptorship contract, read through this very carefully. All right, there's a lot of information we gotta fill out on this one. Your student name, the name of your preceptor, where you're gonna be. So say you're gonna be at East Alabama Medical Center, what unit you're gonna be on. So ICU, mother, baby, something like that, all right? Your preceptorship, you're required to complete 120 clinical hours, all right? That consists of 10 12-hour shifts. There's also a box that says 15-hour, not 15, 15 shifts, 8 hours, 15 shifts. None of y'all are in that box or category. So you should complete 10 12-hour days. You're not allowed to do partial shifts. You must complete the whole thing at one time. So 12 hours, 12 hours, 12 hours. So if you have a doctor's appointment at 2 o'clock and you're gonna be away from the hospital for 2 hours, don't schedule yourself for that preceptorship day. You must complete the whole entire shift, okay? So when you're meeting with your preceptor, you can start filling out the days that you're going to precept. That's what this 1 through 15 is for. You're gonna start writing your days out. They may or may not know their schedule fully out till May. That's okay, they may only know it a month at a time. Fill out as much as you can on this, all right? And then as they get their schedule and you continue to meet with them, we'll add more days to your contract. But to get things started, get things rolling, fill out as much as you can on this. We can add to this later, that's okay, okay? And then, of course, you're gonna put your shift as well. The hours of the experience will begin, so if you're working 7A to 7P of each day. And then you're gonna sign, your preceptor's gonna sign, and then I'm gonna sign after that. Okay? That make sense? Okay. Now, I have got to have this form right here before you can begin your preceptorship. If I do not have this form and you start your preceptorship hours before I approve it, you fail 221, okay? It's that important. I've got to have this before you start a single day of clinical, all right? So, other things, other notes for your preceptorship contract. Communication is key. It's very important to constantly communicate with your nurse, that's precepting you, and with me. As you're fill in this information now. Make sure you go ahead and get their contact information, how they like to be contacted, either text message, calls, what time of day, that kind of stuff. If they work nights, probably later in the afternoon, you're gonna call them. And then you have my information as well. And so once you turn this in, once I sign off and approve, and then you know further, say a month down the road, you know you're gonna work your other shifts, email me. I can add it to your contract in your file, and you can continue working, okay? You don't need another contract every time you decide you pick up more hours. I'll add it to your contract in your file, and you're free to keep going. But you have to communicate with me, all right? If I don't send you an email reply saying you're good to go, or you're signed off on it, you're checked off on it, those new dates that you add to your contract are not valid, all right? That's why constant communication is important. If your nurse calls out 30 minutes before their shift starts, they're supposed to let you know as well. And then you're gonna let me know. Either you're gonna text me, or you're gonna email me and say, hey, my preceptor called out, I won't be there today. I've gotta reschedule a makeup day, because things happen, okay? Other things, say you get your preceptor gets low census. You work till 5, 6 o'clock. You've got an hour and a half, 2 hours left in your preceptorship shift, okay? Remember, we have to complete the entire shift. We can't do partial shifts. That's when a phone call or a text message to me is gonna be important, saying, hey, I've got low census for my preceptor. Am I allowed to stay at clinical? We'll come up with a game plan. Usually we allow you to shadow the charge nurse. We'll let you ask the charge nurse, hey, can I shadow you for 2 hours to complete my shift? During that shadow experience, you're not allowed to do anything interventional. You're not allowed to start IVs. It's more of a shadow, observe type of role. But it gets you through the rest of your shift. So you didn't do 10 hours for nothing, okay? That's why communication is important. If you're ever unsure of anything, please email me, please text me, please call me, okay? Now, if Natalie just calls me and says, hey King, how you doing today? That's not appropriate, okay?
Whoa.
All right? Relating to preceptorship, if you have a question or a concern, please reach out to me. That's why it's important. If you're not gonna be there that day, and I've gotta drive all the way to Birmingham, and I'm sitting there in your unit, and you didn't tell me, I'm gonna be very upset that I drove all the way to Birmingham for nothing. Or if you're precepted in Montgomery and I have another faculty member come and check on you, they're gonna be mad at me because they drove all the way down to Montgomery for no reason, all right? It's okay if you have to reschedule stuff. Life happens. You're sick, your kids are sick, something along those lines, and you have to reschedule. It's okay. You have plenty of time to complete your preceptorship. All right? Questions about that? Yes?
Okay, so we have to get them to sign this paper before we can start.
Mhm.
So do we just go to the hospital and see them, or?
So when I release this information in just a minute, it's going to tell you where you are, so what hospital facility you're gonna be at, what unit you're gonna be on, what nurse you're gonna be with, what shift you're gonna work, and then how to contact them. Usually it's either a unit phone number, so it's just the general line for the hospital, and you'll have to ask to be transferred to a specific unit, and then try to get in contact with that nurse from there. It may be just an email, and you'll reach out to them that way. Now, if you have to travel a great distance, and it's hard to get to that area, get it signed, come back, we'll allow you to get the stuff filled out, send me an initial picture or scan of your contract, as much of it you can fill out as possible. So if you talk to them about their shifts over the phone, and then you fill this out, what you wanna work, you can send a scan to me. I'll give you an initial check off saying you're good to go. That first day of preceptorship, when you go for your very first shift, you can get them to sign and date it, and then you will bring it to class the next day, the next time we're here, and then I'll sign behind you saying complete, all right? You'll be on hold until I get this paper, but you can go ahead and start your preceptorship. That make sense? So Natalie already knows she's going to Birmingham, so you could probably do that. That would be,
Also broke a rule, they told us to text, so I texted.
that's fine. We'll get to it. Do you have a question? No? Okay.
I have a question.
What's up?
So this is not gonna be like how when we go to clinical and a nurse does not want to deal with us. So they have agreed that they want us to get to work.
Yes, yes. They are willing, able, and love students. They're here for you, okay? If, for some reason or another, you're having a bad clinical experience, give it a few days, make sure y'all just weren't having an off day, make sure you can vibe together. But if something happens for some reason or another and you're not having a good clinical experience, please let me know. We'll investigate a little bit further and see if we get a different opportunity for you, okay? All right, questions about the student contract? Yes?
So we're only working with one nurse, like, even like if our schedules are not matching up whatsoever, we can't have another, if that makes sense?
You're assigned to that one nurse.
Okay,
For some extenuating circumstance, if you're not able to find a single shift, which is hard to do, we'll try to find you something to make it work for you. But whatever unit you get, whatever nurse you get, that's what you get. I can't make any exceptions, I can't change anything, you're there, okay? Now, say Drew's nurse had a massive heart attack midway through the semester, and he is going to be out for a significant period of time. That's gonna be an extenuating circumstance. Now, Drew can't just go find another nurse and say, hey, can I follow you for my next 5 shifts, and agree to it and just keep going.
So I failed.
You fail, that's exactly right. That's where constant communication comes into play again. Let me know, all right? We'll get with the preceptor placement people, wherever facility you may be, we'll get in contact with them. We'll talk through it, we'll find another preceptor for you. If that happens, you gotta fill out all this information again, okay? I gotta have a contract on file with the nurse you're gonna be with, all right? That's why when you go to the facility and your nurse is not there, and you just decide to go with another nurse, is not acceptable. I've got to have a contract with you, with your nurse, to keep us safe, to keep us accountable. If something happens, then we could get in a lot of trouble for it. But I gotta have a contract for the nurse you're gonna be with. If they're not there for some reason, please let me know, and I'll let you know how to proceed from there, okay? Anything else, question-wise, about precept contracts? Nope, okay. The last page is your rules of preceptorship. So let's read through these, so we're all aware. You must have a contract agreed upon and signed by you and your preceptor and returned to me for signature before you may begin completing your preceptorship hours. All right, preceptorship hours, February 3rd, which is tomorrow, through April 26th. All right, that's when you can complete your hours. Don't care when, how often. If you want to spread them out, we highly recommend that you don't do them all in one time. Because remember, you have other obligations as well. You have your clinicals, you have your sim lab, you have your unit exams, you have your HESIs. There's a lot of balance. We give you the freedom to pick your shifts how you want to because you know your schedule. I know you have life obligations as well. You gotta work, you gotta take care of your kids, you got other things, all right? But I must have a contract before you begin. Otherwise, like I said, you fail 221, okay? So please take this seriously. If you're not able to get to your preceptorship, remember to fill out this information as much as possible. Contact your preceptor, get all the details. Send me an initial scan of your preceptorship contract that very first preceptorship day you can get them to sign it, and then you can scan it and send it to me in email. Okay? But until I tell you you're good to go, do not start clinical. Do not start preceptorship. Must read the preceptorship manual in its entirety prior to beginning your preceptor rotation. Remember to always keep it on you at all times. Texting your assigned nurse as an initial means of communication is not appropriate. Your initial form of communication is a phone call, unless they've told you you can text. That's okay. Some of y'all, I think Natalie's the only one that's been in orientation. Everybody else hasn't required to be in orientation. But you text them and say, hey, what's up? I'm your nursing student, is not appropriate. Remember to maintain that professionalism. You're representing Southern Union as a student nurse. You, like I said, when we look at our preceptorship assignments here in just a moment, you may get just an email. So reach out to them by email. Tell them who you are, what you're doing, where you're from, and that you need to discuss paperwork, schedule, that kind of stuff. If you get a phone call, it may be a cell phone number. You can try and call it and see what happens. If not, you can call the main line of the hospital and tell them to get you to transfer you to whatever particular unit you're working on, and you can tell them who you are and what you're doing, and they'll get in touch with that nurse for you if they're working that day. If they're not working that day, say, hey, can I ask when they're working next so I can get in contact with them, or can I leave a message for them, something along those lines. If you're not able to communicate with them, then you maybe reach out to the charge nurse on that floor too, or the supervisor, the nursing supervisor on that unit, and they can get you in contact with that nurse as well. They're good about communicating. Usually we don't have those kind of issues though. Give it about a week. If you're in constant contact, trying to get a hold of them, we're not bugging them, we're not calling them every 10 minutes, but try to give it about a week or so, and then let me know if you're having troubles with your contacting your preceptor, and then we'll get involved as well and try to get you in touch with that preceptor. Okay. Give a copy of the preceptorship manual, preceptor letter to your preceptor before you may begin to complete your preceptorship hours. Main thing is give them your letter, your initial letter. Allow them to read through the preceptorship manual. They have done this a lot and often, so they kind of have a general idea of what they're doing anyway. But just to make sure that they're on the same page, get them to read through this preceptorship manual with you, just so they kind of know their roles, responsibilities that they're a part of. Okay. Number 5, we've already talked about it, we'll say it again though. No partial shifts are allowed. Complete 10 12-hour shifts or 15 8-hour shifts. Nobody qualifies for the 15 8-hour shifts. Everybody's gonna be working 12s. So it'll be 10 12-hour shifts. Okay? You can perform more than 120 hours if you want to. Some students are real gung-ho and they wanna do more. That's completely okay. They want more experience, they're trying to impress somebody. Something along those lines, you can do more. You gotta let me know though, so I can put it in your contract agreement as well. But you can't do any less, all right? You're required to do 120 hours at least. That's the bare minimum. You can go over the minimum though. When I was in school, I was just trying to survive, so take it like you would. We recommend 1 shift a week, at least. You can do 2, 3 is pushing it. You have a lot of other obligations. Remember, you gotta study, you gotta do those other things. Spring break's coming up. Everybody but Natalie is gonna be free. So you can do your preceptorship rotations then, if you wanna stack them, because you really don't have any obligations during spring break. Remember, you do have an exam that Monday, but you can stack it then if you want to get some good hours in. Okay? Your assignment is what it is, unless there's a mix-up or miscommunication with the facility. So the only reason you should contact me in regard to your placement is if you cannot, after multiple attempts, get in touch with your assigned nurse or some other significant issue arises. So like I said, if Drew's nurse has a heart attack or something like that, or they're gonna have a surgery and they're gonna be out for 6 weeks. That's a good chunk of time. It's gonna be very hard for you to get your preceptorship shifts done in that amount of time. So we probably need to look for another preceptor for you to get your shifts in, okay? But communication is important with that, so. Sometimes they no longer work there, they quit midway through your preceptorship, and we'll have to make some arrangements, smooth things around. It does happen, but not often. Number 7 really doesn't apply to us a whole lot, but if you are performing a night shift preceptorship, you may not work a shift prior to class, an exam, or any other assigned clinical, so schedule accordingly. That really doesn't apply to us because we're a night cohort. So if you want to work a Sunday night and you're able to sleep all day and come in at 4 and be ready and prepared, then you can do that. That's okay. But remember, you have obligations to us as well and to your class as well. I don't want you to be so focused on preceptorship that you forget about everything else. All right? You still got to make the grade to pass, even if you complete your preceptorship hours. Okay? The only time that's really going to make a difference is your Children's of Alabama Day, so March 20th, right? Something like that. March 20th. You can't work that Thursday night. So you got to be at clinical Friday morning early. All right. And then you can do it, but I probably wouldn't encourage it. The career fair day. You have to be here at 1, so it's a little bit earlier in the day. If you can manage it, that's fine. You can work that Sunday night before and come in that Monday, whatever you want to do. But the big thing is that Thursday before your Children's of Alabama clinical. All right. Otherwise, you can work night shifts if you're going to be on a night shift rotation. Trajexis, you're not done with Trajexis just yet. You got to do Trajexis with your preceptorship as well. You're going to clock in and out for every preceptorship that you do, just like you do in clinical. Big thing is you don't have to do your skills offs. You don't have to do your DCRs. All right. Your skills checklist, that kind of stuff is going to take the place of your preceptorship or your DCR logs and stuff. Okay. Continuing on with Trajexis, this is the big thing. Highlight this. You must have your precepting nurse scan the QR code located in the Documents tab of Trajexis within the last 30 minutes of each of your shifts. So you clock in, you're getting down to about the last 30 minutes. If you're gonna forget, set a timer. So you're not gonna forget, alarm or something that goes off. So like, oh, I gotta do my preceptorship QR code. And it gives you just some generalized stuff, kind of like I do a daily clinical evaluation for you for clinicals. Same idea for your preceptor. They're gonna fill out this quick little form, jot some notes down, they'll submit it, okay? You get one miss, and then after that, we'll have to kind of follow up on disciplinary stuff, but one miss, and then we'll go from there. So that's very important. He said, do whatever it takes to remember to do that. So usually when you log into Trajexis, you clock in, and then I think it's on the top left side, you have the 3 little lines. You click that, there'll be a Documents tab right there, and it'll say something about preceptorship. There'll be a QR code for them to scan. And of course, clock out at the end of your shift. Number 9, you can start that one as well. I've been saying communication a lot, but that is one of the most important things, that constant communication. I gotta know where you're at all times. I don't want anything to happen and you're supposed to be in a place or you're not supposed to be in a place and we lose track of you, okay? And it also goes communication-wise with your preceptor. So email-wise, if you need to change a day with your assigned preceptor, so if you need to change up one of the days that's on your contract and it's not within it's like a week out and they already know that they're gonna miss that day, we can go ahead and just change up your day. Or you had an unexpected doctor's visit that you forgot about, you can change that as well. You can email me that and say, hey, I need to change, March 10th, I need to change it to March 11th, something along those lines, alright? And then you must get an email back from me saying that's okay. That I received it, that I'll change it on your contract, you're okay to work that shift. If you don't get a email confirmation from me, then you cannot work that shift. But I'm pretty spot on with email communication, especially this semester. I'll be quick and fast. And then text or call is appropriate as well to me. Again, your first initial communication with your preceptorship, try to call them. If they say, hey, you can text me, then you can start building that rapport with them and text them after that. But that initial visit, try to give them a phone call. So if you need to call out for a shift, so you woke up that morning, you have the flu, and you're supposed to be at your preceptorship spot at 7 a.m. and it's 5:30, 6 o'clock, text me and just say, hey, I'm not gonna make it. And then also notify your preceptor. You don't want them sitting there waiting on you, expecting you to get there. This also goes for you being late as well. If you're too late into your shift, preceptor may just say, hold off, we'll go on another day. Same with me. Email me, text me as well, notifying me that you're going to be late. If it's 5 a.m. and you gotta call out and you try to call me and I don't answer, there's probably a reason. I'm asleep, okay? I normally don't get up to about 7 a.m. and I put my phone on do not disturb, so only Courtney or my mom can call me. Everybody else, it goes directly to voicemail, okay? But text me. I'll see that text message when I wake up. Email me. I'll see that email when I wake up. That's the first thing I check. I check my texts and my emails. Make sure I didn't miss anything. Usually, I don't go to bed till 10:30, 11, sometimes midnight, so I'm usually up pretty late. But if you don't hear from me, that's probably why, okay? The only other thing I can say is the week of spring break. I will be in Ecuador. So if you don't get a direct phone call, that might be why, okay? Text me, email me as well. During that week, we'll also have Dr. Howell, who's the day cohort instructor. She runs preceptorship for them as well, with Dr. McCarty. We'll have her on board as well. And so if all else fails, we can get you to contact her as well. We can give her information. But that should be the only week that I will be hard to reach. Other than that, please reach out to me, okay? So, number 10, you're required to complete 2 preceptorship logs. Your preceptorship log 1 is after your first 5 shifts. Your preceptorship log 2 is after your last 5 shifts, or 10 shifts total. So preceptorship log must be submitted after your first 5 precepting dates and your second one at the conclusion of your 10 precepting dates. These are mandatory for you to do. They're not for a grade, but they are mandatory that you complete them. When I release this module, you probably have already seen it pop up as well under created assignments. There's a spot to upload preceptorship log 1 and preceptorship log 2, okay? When you get a check mark from me saying you're good on that, it's complete, you don't have to worry about it anymore. But I'll give you constructive feedback. I may tell you to write a little bit more, tell me a little bit of detail on this, and you may have to resubmit, okay? This is a really good chance to talk about your first 5 shifts. So in your preceptorship paperwork, I've got a template for you. And this is what your log is going to look like. Human flourishing. How did you do that in your first 5 shifts? Your nursing judgment. This is very similar to the DCR that you fill out on Trajexis, just paper form, all right? Now, don't just say nursing judgment, I put on gloves because I had HIV. I want some detailed meat in this preceptor log, all right? Stephanie, you don't have to write 20 pages in it, okay? Hannah and Haley, you don't have to write 20 pages in it, but I want some good meat in here. I want some good detail of your first 5 shifts, all right? Okay. Same with Preceptorship Log 2. It's gonna be the same formatting. And you'll see your list. So spirit of inquiry, professional identity, nursing judgment, human flourishing. Okay? Your Preceptorship Law Guide kind of tells you the purpose. It also tells you what human flourishing is about. Being an advocate for patients and families in ways that promote their self-determination, integrity, ongoing growth as human beings. Okay? That's what you're gonna write about for your first 5 shifts, your last 5 shifts in that box. All right? Other things. Here's a good example of your human flourishing, your nursing judgment. So if you need help with it, these are. Hopefully I didn't duplicate the one on the bottom because I just saw that. But here are some good examples if you need them. I don't really care the format. If you want to pull it straight from the preceptor log template and just type into that, that's fine. If you want to write it out, that's fine too. But please make it evident what you're talking about. So put a header in there somewhere that says human flourishing and talk about human flourishing. Then put another head in there for spirit of inquiry and do it from there. If you want to type it on a Word document, that's fine too. Just upload it to your assignments. Questions about preceptorship logs? No? Okay. At the conclusion of your preceptorship time, you must return the completed student clinical requirements and clinical evaluation tool. Okay? And then your assigned preceptorship log, as well as the above mentioned paperwork, have to be returned before your final exam in order to receive a grade in the course. Otherwise, you'll receive an incomplete and you will not be allowed to graduate. Okay? I hate for you to invite your entire family to pinning and you not walk across the stage because you didn't turn your paperwork in. All right? So, what does that mean? That means that I need your skills for your preceptorship with all your initials on it, how many times you did it, that kind of stuff. And then I also need this one as well, where it's your preceptorship comments and attesting that you actually did complete your 120 hours like you're supposed to. I need that. And then I also need your student comments and where they signed. So I need your completed student manual, preceptorship manual. I need your 2 preceptorship logs as well. Okay? Otherwise, you cannot sit for your final HESI until I get those complete. Later on in the semester, you'll see an assignment pop up that says completed preceptorship packet or something along those lines. Once you get a check mark, you can breathe a sigh of relief. You're done with preceptorship. You don't ever have to think about preceptorship again. Okay? But until you get that check box or that check mark, you can't sit for your HESI. Okay? Questions about the roles of preceptorship? Questions about preceptorship at all? No? Okay. I printed all these off for you. Keep them with you if you need to, but if for some reason or another you lose it or something along those lines, it's all for you to print off again. All right? If you've done so many skills and you're a super duper nursing student, here's a whole another skills checklist sheet that you can continue your tide marks with, okay? Okay. All right, here we go. So, everything is color coordinated as it should. So Baptist South, if you're gonna be at Baptist South, you're in red. If you're gonna be at East Alabama, you're in yellow. Grandview is gonna be in blue. You've got orangish color for Wellstar, West Georgia. And then purple is gonna be down here at the bottom, all right? I just released it, so this is where you're gonna be, okay? We tried our best. I submitted where y'all wanted, in shift-wise, and this is what they gave us, okay? Overall, I think it did pretty well, so. So of course you see your name, you see, what hospital you're gonna be at, what unit you're gonna be with. Don't worry about the ACE-MAP ID, that's more for me. The shift you're gonna work at. Pretty much everybody's gonna be like a 7A to 7P. Some of the mother baby units do a 6A to 6P at East Alabama. And there's a couple oddballs in there. Let's see. Anna, I think you're gonna be a 3P to 3A.
Interesting too.
It's ER, so they run weird shifts. We'll double check with your.
I'm okay with that.
With your preceptor. Always double check everything. Make sure there hasn't been a typo or something in here when I was transferring over all the information, okay? So if something's off or something's different, please let me know, okay? And then you have the nurse you're gonna be with over here on this final side. So East Alabama, all we got was emails. So email is gonna be kind of your first point of contact from there. I also think I included the main line for the hospital. Yep, I did. Okay, so that's just kind of the main unit line from there. So reach out, and that's who you're gonna reach out to, okay? If it says Baylor out beside it, so Drew, your Baylor shift. Meredith's not here, she's gonna be Baylor as well, so you're working weekends with that, okay? Natalie, you should already know your contact information. Once you get your contract signed, I'll add it into that information as well. Okay. If you're at Wellstar, this might be a personal phone number, it may not. Hopefully it is, okay? Jess, that's a unit phone number, some sort. So just have to reach out from there, tell them who you are, being transferred to L&D, that kind of information. Everybody at Baptist South, so Chuck, Sam, and Josh. Until you complete your ACE-MAP stuff, they don't give me information about contact, all right? So, that brings me to my next point. All your ACE-MAP stuff has to be up to date in order for you to do preceptorship as well. It's the very same as clinicals, all right? You cannot go to your preceptorship if you don't have your stuff up to date in ACE-MAP, all right? I hate for Dr. Shriver to show up and say, come here, get out of clinical or out of your preceptorship, all right? But you won't get your stuff until you finish it all. So constantly check your ACE-MAP, make sure you're ACE-MAP compliant, make sure you're on the left side over there, you have all the green check boxes like you need to. As soon as you complete this, as soon as you complete your contract, you can get started, okay? But ACE-MAP stuff has to be up to date before you begin. Pretty much everybody but Natalie has ACE-MAP requirements they're gonna have to complete, okay? Grandview doesn't use ACE-MAP. As long as your stuff is up to date for us, you'll be okay. A few of you were testing the waters this afternoon, so Sam and Chuck, you've already seen ACE-MAP stuff come through. Nobody else has yet. I will upload all that stuff in the morning. You're gonna get a notification saying you've been assigned to a new clinical rotation, all right? This is that notification saying, hey, you got stuff you gotta do, all right? So go through, look at your files. A lot of it's like TB screenings, flu shots, those type of records. Resubmit the stuff that you submitted to ACE-MAP to the TB screening and those kinds of things, and they should get it approved pretty quickly for you, okay? that sound good? Okay. Questions about your assignments? What's up?
Is that considered NICU or like,
Where'd I pitch?
delivery team?
Yes, I believe so. They also go and like to specific deliveries and then take them to the NICU, or they have like it's not a NICU, but it's not regular floor. It's kind of like a transition unit where they observe them for a few hours, and then they put them with the mama and stuff. So, yeah, you're gonna be catching a lot. So. Yeah, well, sounded pretty cool, I guess, if you like that kind of stuff. So, all right. That's all I have for preceptorship stuff. Okay. Like I said, big things. Constant communication with me and your preceptor. That's going to be the biggest thing for you to be successful. Okay. Let's take 10 minutes. I know y'all are trying to absorb all this stuff in, look at all your assignments, that kind of stuff.